welcome back to the Nursing Zone YouTube channel. In this video, I'm going to explain about an important topic called HPV vaccine or human papilloma virus vaccine. So at the end of this video, you may have the knowledge about the following: what is HPV vaccine, indications, contraindications, and site of administration, dosing schedule, adverse effects of this HPV vaccine, and impact or effectiveness of this vaccine on human beings, and etc. First one, what is HPV vaccine? The full form of HPV vaccine is human papilloma virus vaccine. The HPV vaccine protects against genital warts and most cases of cervical cancer. It protects against cancer of the vagina, vulva, penis or anus caused by the HPV. The HPV vaccine also protects against mouth, throat, head and neck cancers caused by the HPV. What it does means, it protects against genital warts, cancers of the cervix, vagina, vulva, penis or anus caused by the HPV. Apart from the genital organs, this vaccine can also protect against mouth, throat, head and neck cancers caused by the HPV. And how long is the HPV vaccine effective? Studies also show that the HPV vaccine gives long-lasting protection against HPV. Since the HPV vaccine was recommended in 2006 in the US, rates of infection, genital warts and cervical precancers have gone down a lot. So it gives long-lasting protection as it was started in the 2000 years. So far the cases of infection, genital warts and cervical precancers have gone down a lot, have decreased a lot. Next one, vaccine administration site. HPV vaccine should be administered intramuscularly in the deltoid region of the upper arm or in the higher anterolateral area of the thigh. Do not administer this product intravenously, intradermally or subcutaneously. So as it has been said, it should be administered intramuscularly, especially in the upper arm of the deltoid muscle region, and it should not be given intravenously or intradermally or subcutaneously. Next one, indications. The Center for Disease Control and Prevention, CDC, suggests or advises us to have vaccination at the age of 11 or 12. And the ideal age of vaccination is before a person is sexually active. So that means children at the age in between 11 to 12 can get vaccinated. In case of adults, it is advisable to have preferably before their sexual exposure. So before their sexual exposure, one must get this vaccination. Contraindications. Who should not get the HPV vaccine? The HPV vaccine isn't given during pregnancy. Women who are pregnant cannot get this vaccine, should not get this vaccine. And also the HPV vaccine is not recommended if a person had an allergic reaction after the first HPV shot or if a person has severe or life-threatening allergies. That means people allergic to HPV vaccine during their first dose. So HPV vaccine is not recommended for them. And also people who are moderately or severely ill should wait until they get better to get vaccinated for HPV. That means people who are feeling sick or who are actually sick, they should not get this vaccine. They should wait until they recover. Adverse effects. Overall, the effects tend to be mild, so the adverse effects are mild. The most common side effects which can be seen after this HPV vaccination includes soreness and swelling or redness at the site of administration, and also some people may experience dizziness or fainting after they get shot by this vaccine. Staying seated for 15 minutes after the shot can lower the risk of fainting. That means you should not do any activities up to 15 minutes. You should be seated or you should be relaxed. Other adverse effects includes headaches, nausea, vomiting, fatigue or weakness can also occur. So the CDC and the FDA advises us to monitor the vaccines for unusual or severe problems. Next one, dosing schedule. 2 doses of HPV vaccine are recommended for most persons starting the series before their 15th birthday. The second dose of HPV vaccine should be given 6 to 12 months after the first dose. That means the first dose of HPV vaccine can be given to the children who are in between 12 to 15 years old. They can start their vaccination irrespective of the gender. Whether a male child or a female child, they can get vaccinated if they are in between 12 to 15 years old. And the second dose is given after 6 to 12 months apart from the first dose. And adolescents who receive two doses less than 5 months apart, they should require a third dose of HPV vaccine, and 3 doses of HPV vaccine are recommended for teenagers and youngsters who start their series at the age of 15 through 26-year-old, and for immunocompromised patients, 3 doses are recommended for them also. So this is about the dosing schedule of HPV vaccine. Thanks for watching this video. Do like this video and also share and subscribe to this channel, The Nursing Genre, and do watch other content which will be helpful for your studies. Thank you once again.